guys, Assalamu alaikum wa rahmatullahi wa barakatuh. Today we will talk about the second chapter of the human genetics, part 1 of this chapter, and this part 1 of this chapter talk about Mosaicism. The outline of my lecture is first definition of Mosaicism, type of Mosaicism, disorder caused by Mosaicism, diagnosis of Mosaicism, and we will also see who is at risk of Mosaicism. Mosaicism can be defined as the condition in which an individual possesses two or more genetically different sets of cells in his or her body. Of course, if those abnormal cells begin to outnumber the normal cell, it can lead to diseases that can be traced from cellular level to affected tissues like skin, the brain, and other organs. The body of affected individuals can contain thus two or more different genetic cell lines in the same organism or in the same individuals. It can occur either during early or late stages of life of an individual, and it can happen on the gene level or within the whole chromosome. We have different types of mosaicism. In mosaictic individual, an abnormal cell line can be found along the normal cell line. And there are two basically types of mosaicism, somatic and germline mosaicism. In somatic mosaicism, somatic refers to the occurrence of two genetically distinct population of cells within the same individual. Of course, these derive from post-zygotic mutation. While the germ mosaicism means that some sperm or egg have a gene mutation that may not be present in other tissue of the body, such as blood, which is typically used for genetic testing. Mosaicism causes several disorders in humans, and some of these disorders includes echocytosis with confetti. This is a disorder that causes red, scaly skin all over the body. Then we have also Klinefelter syndrome, and in this syndrome, a low amount of testosterone is result, which can lead into problems such as sexual development and other issues. Now, the syndrome, this disorder causes a red birthmark called a port wine stain. It also causes excessive growth of some soft tissue and bones, as well as abnormal veins. We have also another syndrome called mosaic Down syndrome. It's similar to Down syndrome, in which this disease causes intellectual disability, delays in growth, weak muscles, and flat facial features. Another third syndrome caused by mosaicism called Pallister-Killian mosaic syndrome. This is a developmental disorder that causes and leads into weak muscles, intellectual disability, thin hair, patches of abnormal skin color, and other birth defects. So, a syndrome which occurs at chromosome number 14 called ring chromosome. And in this condition, a seizure is result, intellectual disability, and delay in speech and motor development. We have SOX2 anophthalmia syndrome. This is a rare disorder, though it can cause a child to born without eyes. This can cause seizures, also brain problems, and delay in growth. We have also a syndrome called the triple X syndrome. In this condition, an extracellular chromosome extra X chromosome in each of the woman's cells, which can lead into problem in learning, delay language skills, and the problems with motor skill and muscle. We have trisomy 18, also caused by mosaicism. This condition can cause slow growth in the womb, heart defects, a small head, and other defects. Only a small number of children with this condition live past their first year. We have a 10th disease that caused by mosaicism, including or Turner syndrome, in which in this condition the woman that is caused that result in short height, ovarian problems, lack of fertility, and heart defects. How is mosaicism is diagnosed? There are different methods which can be used for testing or diagnosis of mosaicism. We have the first, the simple karyotype of a blood sample can be used to detect some kind of mosaicism. Others include fish and microarray-based tests. This would be necessary in conditions that affect the skin, such as ichthyosis with constipation, the first disorder which we talked about and caused by mosaicism. Of course, we can also use what's called comparative genomic hybridization, and we will talk about this technique in further detail in other chapters. Who is at risk of mosaicism? Today, there is no way to predict mosaicism. However, mosaicism is often discussed during in vitro fertilization because doctors will usually perform a pre-implementation genetic screening (BGS) before inserting the fertilized egg into the woman. The woman will want to talk to specialists to understand the risk of mosaicism in embryos before implementation. If we want to summarize this lecture, we can say that mosaicism occurs when a person has two or more genetically different sets of cells in his or her body. If those abnormal cells begin to outnumber the normal cells, it can lead to several diseases as we saw in a previous slide, and these diseases can be ranged from cellular level to affected tissue like the skin, the brain, and other organisms. Mosaicism likely occurs on small, unnoticeable level in most humans. It also happens after the sperm fertilize an egg, forming the zygote, which grows through a process of cell dividing over and over and over. There is currently no way to predict mosaicism. Mosaicism actually is a topic that is often discussed during in vitro fertilization because doctors will usually perform a pre-implementation genetic testing or genetic screening before inserting the fertilized egg into the woman uterus. We saw also that mosaicism can cause many different kinds of disorder. شكرا جزيلا.